Hi guys, welcome to Unidentified podcast. So just so you know, COVID is back on the rise, and this is the news report. Let's go ahead.
Cases are on the rise across the nation and in our area, which means something many of us thought we'd seen the last of is back. Businesses, hospitals, even colleges, including one in our area, reinstating mask mandates. So will there be more to come as we head into the fall? And are people ready to be forced to mask up again? Kendall Green joins us live in the studio. Kendall, what do health experts have to say about it?
Good evening, Steve. They're saying if you don't have them already, it may be a good idea to stock up, and if you do, keep them handy. The current COVID trend we're seeing, more mask mandates could be in false forecasts among companies and colleges.
New data shows
Go ahead, Simon.
not rules just yet with
Wait.
COVID-19.
Hear this.
In fact, the numbers show the last few weeks it sent more Americans to the hospital.
No, I
An
didn't.
increase of more than 20% from last week in deaths and hospitalizations nationwide.
Straight up lie.
There's a lot of circulating COVID right now.
Dr. Stephanie Silvera, an epidemiologist and professor of public health at Montclair State University, urges caution of the new threat on the horizon. Though the number of cases of variant BA.2.86 are sparse in the U.S., the newest strain is
That's COVID right there. That's COVID. That's what it looked like.
While it's on the rise in Europe.
There's a growing concern that alternative vaccines
By the way,
are not going to be as effective as they have been in terms of reducing both spread and severity of illness.
Yeah, losing weight does that too.
Rising case counts, companies like California-based Kaiser Permanente mandated its staff wear masks on certain floors of their facility. Closer to home, Upstate Medical University in New York and Rutgers University took similar steps. The epidemiologists in favor of calls for caution considering the newest variant's impact overseas, though fewer cases have been reported in the United States.
In thinking about what is the next step in terms of public health and how to prevent further spread, unfortunately, masking is something that we need to consider, even though most people don't want to.
Some New Yorkers telling Fox 5 they're willing to comply with potential mandates.
I don't want
Okay.
to get sick. I like being alive.
I think that it would be super helpful if the spreading again.
All right. So, okay. The reason to bring this video up is that this is what they're showing people. Okay.
By the way,
big,
to add to it, my cousin's family has COVID right now.
Hmm.
They're a family of like 4. So yeah, the whole family got COVID.
I don't think
Yeah.
COVID exists. I'm just gonna be. I don't think we see.
Can be on the rise again.
Okay. So, okay. Are you gonna okay? I have a problem with this because this is what we showing people, right? We trying to scare these people, okay? No offense to anybody. You're doing your job. Do by all means, whatever. But okay, you're talking to me about numbers. Let's get this straight real quick and let me know if I'm wrong. For what I remember, we used to have high numbers, right? Correct, right?
Yeah.
These numbers have been proven to been messed with, right?
Yeah.
Okay.
Car
Then we
accident,
gotta-
COVID, heart attack, COVID, drive-by shooting, COVID.
Well, yeah. Well, then like these COVID cases were things that you wouldn't survive. First, they tell us you needed a respirator, a machine to help you breathe, and then we discovered that this machine was what it was doing was killing people,
Yeah, it was killing people.
right?
Yeah.
And then like this, out of desperation, I mean, out of a freaking miracle, here comes a vaccine that's gonna save your life. This vaccine right here, they showed us statistically, this is gonna save your life. This is the solution to your problem. This right here is what we need.
Yeah, and a lot of people took it. Yeah.
So we started taking these vaccines, right?
Yeah.
And then they tell us, well, the solution we gave you and we told you this is the solution, this is the way out of this situation.
Yeah. Well,
It's for us to give you a booster because it's not working.
yeah, took the booster too.
Yeah, take the booster, right? Then second booster, wow, take this. And now you're good because we got a
Yeah, we
variant
good now.
that's a little stronger than the solution we used to have, than the miracle we showed you a few months ago. Then another booster comes out. What kind of freaking sickness is this that your miracle drug is it's not affected? I mean, are you making this? Did you design this just good enough to kill like just good enough, like a little over the head of this virus to just like kill it and it's done. We don't want to put too much in there or make it too strong or effective. We're just gonna make it effective enough to save your life.
But if not everybody vaccines, then it won't work.
That's my favorite part. Everybody got to take it in order for it to work.
Because it's not gonna work because everybody that's unvaccinated is threatening
But
everybody.
how does that make sense? If you have it, your life is safe regardless of what I decide to do.
Now you need to take it too. Okay, you need to take it too. If I got a headache and I take aspirin, it ain't gonna work unless you take it too.
You remember in the hallways, you and me used to talk. We used to get very close and talk, and a lot of times we didn't have masks, and we made it through. Thank God, of course, right?
Sick.
We don't have the freaking miracle vaccine. Okay, then it comes out that and in one of our episodes, I told you when these commercials start coming out, and if you think I'm crazy, just look it up. We have plenty of videos talking about this. When I jokingly say, if you or one of your loved ones have been affected by this vaccine, and you remember when I said that?
Yes.
And guess what we see in today? If you or one of your loved ones, unfortunately, and it's very unfortunate because we already lost these lives that we never get back. A lot of people lost their parents, let's say, due to the remedy to this miracle you showed me that was going to save my life. And instead what it did was put me in danger, and now we acting like it happened.
That never happened. That was stress. That was maybe you're working out too hard. Climate change.
Come on. Okay. Well, I'm saying this to say, bro, like, are you gonna fall for this again? We're gonna wear a mask for such a dangerous virus, and the mask is the solution.
Yeah, and the people who tell you to wear the mask,
Now-
they don't even wear it.
The not the 20 vaccines. The mask is gonna be more effective than these vaccines. That's what we gotta do. Mask up again. I'm not against a mask. If that's what we gotta do,
I don't like
then
wearing
that
things.
no. But I'm just saying, like, for example, if that is the solution, let's do it. Let's all do it, right? But it's proven. It's proven that it didn't do anything. If you get it through your eyes, we're gonna cover our eyes. Like, we're gonna get little masks for our eyes, or like what we do, gas mask or something like that. Like, what are we gonna do?
It's been proven that these masks are toxic, that it restricts oxygen, and it hurts
Mhm.
little kids who are trying to learn how to talk and learn social skills because their faces are.
By the way, that has actually been proven. That's thank you, Ed. It's been proven, and the process in which they make these masks. Read the back of the mask. There's a lot of things. I don't want to call them ingredients, because ingredients you would say for something you ingest, right?
You're ingesting that mask.
Uh, but in the process of making it, there's things that are hazardous for the human health.
Yeah.
Do you hear what I'm saying?
I hear you.
Now, this is not to say that COVID is not real.
I,
'Cause
say,
lost
I
people.
don't think it's real. I'm just being real with you. I don't think it's real.
But okay, and that's good. But when you say it's not real, what are you referring to? Because nigga knows people who are sick right now.
Point blank,
I know people who died. I lost people over this, man, and so that must be real.
No.
Now, well, I hope when you say real, you are referring to us fabricating this.
I mean,
Like,
the whole
actually, like,
thing was
intentionally.
just straight up fake. I don't even believe the Wuhan lab. None of it was real.
No, I don't believe that either. But I believe there's a sickness.
I'm not going to convince you. I'm just letting you know.
Well, regardless of what, I just think there's something out there that's knocking people out, regardless of what. Because I had it and I felt sick one of the times out of 3 times.
Angel, I remember when I first met you. We going back years before COVID. I always looked at you. Why is this dude sick? always sick. Like you got the flu, coughing up stuff, can't breathe. Like, bro, like, why don't you take care of yourself and run and start working out? You won't get sick. Don't you remember me telling you that years ago?
Yes,
I'm like, why
yes,
are you getting sick?
I do actually. Uh,
We didn't call
regardless
it
of what,
we didn't call it
let's say
COVID back then. We didn't
Well,
call it
I do
COVID.
okay.
run. I do
So we got
work out.
these athletes. We got these athletes, right? And they just dropping dead.
Oh,
So
it's long COVID.
it's long. It's a long.
Long COVID.
I got you.
Long COVID affects the heart and the internal organs and stuff.
And then the fat people are dying from what kind of COVID?
It's long COVID too. It's all long COVID.
All of it.
Yeah.
Even the healthy ones, the ones that got good lungs and
That's
do
who
workouts
long
and
COVID affects the
cardio.
most.
Wow, that's crazy.
Yeah.
So stay still, like what we do.
Yeah.
Okay. Well, enough of this sarcasm. I believe is in a rise, and I believe, but what I actually believe is that it didn't work well enough the first time around, and not enough people were scared enough to take this vaccine. Now we got this mosquito that the freaking 502.0. Like what was it? That mosquito? You know about it, nigga, right?
Yeah, I have a video, but I don't know the name of the virus or the.
I don't know. I'm just making it up because it's freaking made up. Like we are doing this to ourselves. Like, well, not to ourselves. You know what I mean? But like humans to humans is what I'm referring to. Like that. This isn't set up. Are you gonna fall for it, nigga? Like, what are you doing? You going for the new vaccine?
I'm making sure I don't get mosquitoes in the house.
Bro, and
That's
that's
impossible.
that's the other thing. I believe this is so cruel, man. Now you have a little baby to worry about. It's not just you now, and life goes on. Okay, it's not just you having a baby, and it's not just me. Like people are living their life. Finally, what is it that you guys want from us? Like let us know. Like, are you trying to what? Why are we trying to reduce the population? What is going on? Tell us what's really going on. Maybe if you like come out clearly
They've
and let us
already
know.
done it though. This is what I don't get. They've already achieved it. So like as far as the population in the West, like they've already done that. You're not going to be able to do it all around the world.
Well, yeah, you will.
Yeah.
Global pandemic. I mean, global medicine. This vaccine was a worldwide vaccine, and that's how you do it. Good plan. Well done, guys. Like,
That's one way to do it. I'm curious to see the next game plan, and
curious. Don't be so curious, guys. Don't get too creative. Leave us alone. Let us live, man. If don't get too curious, nigga. And I don't want to know what's next.
I mean, they did us one with the electrical bill and the gas bills. The gas prices rising. That was also a nice move.
How so? Like, what are you referring to?
I mean, gas prices rising. There was war, Ukraine. That the whole construct seemed edgy and iffy. And
Okay.
I know that a lot of people made money, and that's always going to be the case, where there's
Mm.
somebody's how do you call it? Somebody's garbage is one other's treasure, something like that. Somebody's misfortune is somebody else's fortune, or yeah, I don't know how to word that, but there will always be people making money, and there will always be people that create havoc in this world to make it just to make it
I think it'd be good though if we had like another like one of these viruses that come out. And then, like, let's say if the market goes down again, like, I'll be ready this time. Like, I got so much experience. I'm like, okay, let's go. Let's go. Because I missed out on the first one. I didn't have enough experience, but I'm ready now.
okay. So you heard it right. Get ready to invest all your
Get
money
ready
that
to
you save.
invest. I don't
Get
know.
ready to make money.
I thank you, Ed, for that, and I got it. And like I just unfortunately I defer from that. I mean, no, by all means, make your investments and stuff like that. But if I was to say I'm gonna shut this down, I shut it down, and that's it, right? I think I keep saying this, man. I think we should learn how to be self-sufficient. Okay, I'm telling you guys. I know it sounds crazy. If you have a little bit of land, if you have, if you live in the country, if you live in an area where you can like feed your own animals, grow your own like little food, you should learn how to work the land. That's my opinion, and I get what Ed and the guy in there saying. Yeah, yeah, but that's if everything goes well. But what if we shut down? If everything shuts down, we already experimented with like shutdowns, right? We already experienced no toilet paper, no water, no this, no alcohol, right? Imagine that on a larger scale. We would have been killing each other. We were already fighting over toilet paper.
And let's not forget fighting over George Floyd too.
Okay, fair enough. But right now we are talking about COVID. I mean,
That was a part of COVID. George
That was
Floyd.
the
George Floyd was that happened when we was all locked up with dealing with COVID.
yeah, that
no,
was
no,
the
no.
vote against the I think the lockdowns.
Nah, I don't think so. I think that was government agents getting people riled up. That's what I think it was.
But okay, this mosquito thing. What are the
What is it? Malaria again? Is that what it is in the guy?
it's something new. Like it's something that I guess mutated into something new. But you know what the symptoms are?
What is it? What we got?
Hmm?
I thought you was gonna tell me.
Check this.
Oh no. I don't know. I'm asking to see if the guy knows anything.
No, nothing. I didn't even check the video.
Okay.
I thought it was
We
just
can play
malaria.
it if it's-
No, it's cool, but like what I'm saying is, guys, like let's not fall for this. You know, we can't even like get on the same page with the freaking mask. You see this girl was saying like part of the building had mandatory masks again, and then the other part doesn't.
Yeah.
We can't even agree on that. Like it's
How about
we
this?
not ready.
You want to wear a mask? Go wear a mask. Just
Mhm.
wear a mask if you want to wear a mask. Okay, let's just do that. If
Okay. But the problem is we start judging. We don't stay
I'm
quiet,
judging
we don't sit
everybody I
still.
see wearing a mask. Everybody, I'm judging every last one of them.
We are judging from either side because now I have a mask on and I gotta wear a mask, and you know a mask is uncomfortable. Okay. So I start
You
heading
know,
out,
if I seen
walking
you
around
walking down the
crazy.
hallway in a mask, you know I'm gonna say something to you.
Bro, listen, and I get it, but listen, if somebody freaking forces me to wear a mask, and I see you without a mask, and nobody's saying nothing to you, I'm gonna start being like, yo, like, what's up with this dude? Why is he not wearing a mask? And without even knowing it, I might start acting like it's justified, just because you have to do it as well, not because I think it works, not because I think it's a good step to take. Nah. If I'm doing it, he's doing it.
Bro, every time I see somebody with a mask on, unless you're Asian, an Asian tourist, if I see you with a mask on, I think you're just a bot and you believe everything that's on TV and you don't think for yourself. That's what I think about mask wearing.
Stop using that NPC, that bot.
That's what they are. That's the word. That's the
No,
word.
because then you are dehumanizing these people.
They are,
like,
yeah,
human
there you
beings.
go. Fully.
No,
They are
man.
dehumanized. They ain't human.
Nah, you know why? Because then like we have so many idiots out here, okay? That think we are NPCs and that we are not human beings and
No,
that
they're
these are not actual live,
They're not.
and it's nothing to shoot them because they just NPC. They are not playable, non-playable characters out here. They just standing here. They can be replaced by another one and stuff like that. People are sick, mentally sick, and actually do believe this. I know you being sarcastic. I know you playing with your words. Nah, you believe I'm an NPC.
Not you. I mean, because you're all right. You know, I guess we're kind of cool. I guess, but there are people who
Bro, wouldn't have been able to make these podcasts, man.
Yeah, they believe everything. Like if you just believe everything you're being told, because and it's not even that it's TV, because it's coming from an authority figure. It's like you're not fully, you're not, I don't know, self-aware. I don't know what to call it. Like you just don't question it. Don't question anything. Just whatever you're being told. Just okay. And what's crazy is I could tell you one thing one day, then tell you the complete opposite the next. And you just go along with it. You never say, wait, hold up a minute. You don't do any of that.
No, actually, I heard a lot of people, oh, make up your mind. What's the start? Well, we got
okay, all right. That's a start.
So that is a start.
I heard a lot of these guys like, yeah, I took the second booster. I'm not getting the third. Like, okay, man. Better late than never, I guess.
Okay, we gotta be careful with our jokes because, make an example out of one of us. Well, we're not important enough, I guess, so we safe. But I do believe that would be a thing. Nagayan, what are you doing with that second wave or third, fourth, or all these waves of COVID? What are we doing with it?
I'm gonna be informing people out there just stop doing whatever you're doing, whatever they're saying you have to do. Spread the word. If then they don't listen, they do their own thing. But
bro, I had my dad calling me day and night telling me to get my vaccine.
Okay, does he still believe, or is he like, hey, are we doing?
I don't get into it with my dad. My dad is a street guy, okay? So he doesn't like when people oppose what he says.
I thought a street guy is supposed to be like they ain't down with all this. You know what I'm saying? Like they don't care about all that. You know what I mean? You know what I'm saying? Because they would see it as authority trying to tell them to mask up, or authority telling them that.
Well, he's getting older, and doctors and all these things was telling him like, hey, listen, you getting up there in age, and you should get this and all these things, and people dying from not having it. So he's very street smart. He's very uneducated as well. So like.
The combinations.
It's a bad combination. I mean, when I tell you he's very street smart, that's all he knows. Being outside, tricking people. He knows how to, like, he'll sell something to you that you don't need, type of dude. Yeah. Like, you know what I mean? And you don't need it, but just because he sounds like he's telling you something, you'll buy it. Just. I don't want to get too into that.
Yeah.
But
my dad, he locked himself up. He was wearing masks. He was avoiding people. And yeah, they got to him. Got to him. And bro, he isn't even that old.
I believed it too. I believed that it started in March. By the end of April, I'm like, okay, like what are we doing now?
I just hate them. You know what? I just hate this whole plan, because I do believe that this is just a test drive for something so much bigger.
I'm hearing it's climate lockdowns. That's what I hear is actually what the real plan is, climate lockdowns for the climate.
I haven't heard that.
Yeah. Okay. I didn't hear that.
The next move, then
oh my goodness. But listen, my family is something I'm extremely sensitive about. Maybe I shouldn't put that way, right? But I hated it because at some point I was going to get this vaccine, and not because of me, not because of that. I told you this behind scenes or whatever. But in reality, man, like I had to provide for my family. And the place where we work at told us, like, if you don't get this, you cannot be here. And I was willing to leave that place, right? But like I said before, like, what if I tried applying for the airport, and the first thing they told me was I needed to have my
I
vaccine.
thought
So
to myself, what I have to do is not get it, because if enough of us don't get it, guess what? They're not going to be able to run their business. So we all have to just stand and say, hey, no, this isn't right. We're not doing it.
but this is when people's opinions start like making you uncomfortable, because like I work at a bar and stuff like that, and people were openly asking me and judging me about like deciding not to get it. Did you get it yet? And at the end, I was telling some people, yeah, yeah, I got it. Yeah, I got
Oh
my
man,
vaccine.
that's crazy. That's crazy, man. And then, wow,
Yeah,
wow.
yeah, yeah. I know, and I hate lying, but it's not even that. It's just like this dude came in every single day, and he was so pro vaccine. I haven't seen him in a while. I don't know
Yeah, I
where he
wonder
is.
why. Yeah.
Nope, I'm not saying he's dead.
Wait,
I'm just saying he used to come in every day. Maybe he got tired of coming in.
Oh,
I
okay.
don't know.
Yeah, sure.
But um he would openly like mock me and tell me like I was dumb and I was putting his life in danger. And one time I asked him like if you have it and the vaccine is for you, how am I putting you in danger? I'm putting myself in danger. He's like, yeah, but they say everybody got to get it, or if not, it doesn't work. And I'm like,
What? No.
I don't know.
Oh my. Man. I don't
Yeah,
even.
no, I don't know. I'm
Man.
I'm just saying.
it's a messenger.
Oh.
Messenger.
But listen, but then I'm like, I tried applying, and that's when it became real. I tried applying for the USPA. No, what is it? Postal Office, right?
Mhm.
They didn't really like do too much of a fuzz about the vaccine, but they wanted to know that you had the vaccine. The airport said, if you don't have it, you can't work here. And I started thinking, like, I'm like, okay, so if I don't have this, that means I cannot provide for my kids and stuff. I guess I'm gonna get it because my kids gonna eat regardless of what. They have to eat, and that's when I decided if this gets tight, I'm just gonna get it. I'm glad I didn't. It didn't come to that, but whatever. Um, so is this new wave real, nigga? Like you believe in this? Like is
I
like
mean, the
it
numbers
is
are increasing. I hear more cases around me.
what when I asked you if it's real, what I'm actually asking you is like, did this it is this a virus that kept getting stronger and kept switching, or are we making this happen? Like is
I
this
mean,
like
I
mhm,
believe that it's a virus. I believe that it's real. I
mhm,
believe that just like the flu, it's something that mutates.
mhm.
And just like the flu, it kills people. But it indeed has a sense of being way more inflated than what it is actually in numbers, because yeah, people die every year, people die from flu every year, and if you compare those numbers, I think numbers don't lie, statistics don't lie, data doesn't lie unless it's been tampered with, and you will see quite how do you put it, that the numbers don't really are as much as of an impact as that compared to the flu variant of yeah, the figures. And then you can discuss or when is it flu, when is it long COVID. Those cases, I don't know how many are being reported.
Look, Nagai, and
That's
we got the data.
indeed,
We got the
the
data.
data also says that more patients are being diagnosed with long COVID just because they didn't have any
Nagai,
other
here's what's up,
way.
okay? Here's facts, okay? In
Yeah.
2020, right? I believe it 2020, 2021, the death rate didn't go up at all. It didn't go up. It stayed the same.
Because, but that also people were staying in more.
Okay, here we go. All right.
Wait.
But here's the thing. After everyone got the vaccine, that's when death rates skyrocketed. Yeah. And you got people who actual life insurance companies, these guys who they study this, because you got to pay that money out. They're the ones who track this. And it's like, okay, death rates didn't go up during COVID. When after COVID, after the vaccine, that's when it skyrocketed. Like you can tell that way more people than you would normally have are dying. Way more. And they're young people. And this is insurance companies.
Yeah.
That's a fact.
But isn't also the case that because of COVID, because of the lockdown, because of all the restrictions,
social distancing,
exactly,
the lockdown. Yeah.
Actually, very.
Oh, you're right. You guys are right. They get heart attacks. I'm sorry. You stay in the house too long, you get heart attacks.
No. I'm not saying that they only die of heart attacks. I mean, there's more causes of that. But it would indeed. I'm not saying it's all COVID. It's not COVID, or it's the vaccine, or it's not vaccine. But I'm saying that because of certain effects, because of certain measures, if you give the vaccine and you say, yeah, you can go out now, people will go out and they will party and they will go crazy. So, yeah, they will do coke and they will do
you're right.
Lots of drugs.
A little too much excitement. Okay, all right.
Okay, all right. There was COVID parties out here, like to see who would get COVID first and stuff like that.
Really?
Yeah. People are crazy. But okay. But this is my thing, okay? So COVID is real. COVID's here.
Your opinion, sir. Your opinion.
No. I'm saying in the case, in the scenario that COVID is here, COVID numbers go up, people start dying over COVID. Do we get a second lockdown or what happens now?
If enough of you people don't wake up, yeah. If you keep believing this is real, then yeah, they're gonna keep going with this all the way.
Oh. Let's say the casino closed, bro.
Okay.
So what now? What we do?
Bro, it's up to each and every individual person to make sure that doesn't happen. But I don't know. I don't have a game plan for that. I don't know. If the whole world shut down, I don't know.
It's these numbers. I mean, let's say Niagara Falls, right? This is Niagara Falls. If the city of Niagara Falls says 27,000 people died today, all they gotta show us is
you can say whatever. I need to see body bags. I need to see bodies in the street.
I'm going there. So all they gotta do is show us the same news from different angles, and it seems like a lot is going on.
I know for a fact more people are waking up. They're starting to realize that the news is fake. Probably not these old people, but the newer generation. They get it. They're starting to get it. It's fake.
So we safe. We not falling for it. That
I don't know, man. I can't say that, man. I wish I could, but you had a lot of people that woke up. Me, I used to be asleep during Barack Obama years. That's when I woke up. I said, okay, this is crazy. Some people, COVID is what did it. That's what.
I mean, this woman in the news, she looks not older than 30, 35. She is agreeing with the mandate for masks. I'm still baffled that that's something that they're going for, but
bro, there's a lot of people.
Yeah.
Matter of fact, the girl that Angel works with, she wear masks all the time. I'm just like, why she got this?
No. She wears that mask because she works in the smoking section, and that smoke out there gets crazy.
Bro, that mask is not protecting. Oh my god.
It is a filter at the end.
No, it ain't. Come on, man. How about you go deep sea diving with that mask on too? Like, come on, dude. That mask ain't doing nothing. Stop it with this mask.
Sorry if you're looking, but that was funny.
I think it is doing something.
Yeah,
It might be doing something.
yeah, it's preventing you from
I'm
getting
not. I'm
oxygen.
not saying she's safe. I'm not saying that nothing's gonna happen now that you put that mask on. That's not what I'm saying. I'm just saying I think
Something
it's.
that's
She's covered in tattoos. She look like she tough. What, a little smoke gonna bother her?
You see how little she is. She
So
got like. Nah, she's a good person. I like her.
anyways. If you're out there wearing a mask without the reason for it, think about it. Check the news channels before and after, and check the data.
Mm.
What actually works for you. If you feel comfortable doing it, please don't judge others for not doing it. We are here.
I thought we were gonna learn that freaking lesson, man. Just
Yeah,
like,
but yeah.
we need to get and like Ed said, he said in a different word, in a different way, but like let's stick together, man. At the end of the day, we are the people, man.
Yeah, and we have freedom of, I think, choice as well.
no.
No? Freedom of opinion.
Nah, if enough people stand together and
Yeah.
we like find a way, we can find a way. I'm sure of it. He thinks is investing in the stock market.
That would
I
be a
think-
good thing to come out of this, because I'm just getting my money right and everything. It'd be yeah.
I think it's a good one as well. But I'll tell you this though, I really think being self-sufficient is key. No matter what happens, moving forward.
I agree with that. And it's not bad to know from multiple things. To know from different things something.
Mm-hmm.
You can build upon that. So
Yeah. Have you
check
also,
full trades.
if you would like to learn a little bit more about this, you don't have to look at us for it, but I'm willing to talk about like these things. If you're interested, just let us know. On another note, for those who keep asking us about more episodes, that's not many people, but for those who are waiting for new episodes, we working on it. It's coming up. I hope you have enjoyed the ones we have already worked on and that are, out. We are working on some things. I hope you have noticed the improvements, and we still working on plenty more. As always, leave a comment. Let us know. Leave a suggestion, and Nagayan will do a better job at getting back at you guys on the comment section. No, but if anything, feel free also to direct your comment towards one of us and specifically one of us, and we can have a conversation on there. Let's start there. Okay, leave our names. You know who we are, and we can take it from there. Thank you for watching.
Unidentified.
Unidentified.